Healthy blood flow is important to keep the body functioning normally, because blood carries essential oxygen and critical nutrients needed for cell survival to all of the organs and tissues in the body. In sickle cell disease, blood flow in the smallest vessels can be very slow, particularly during a painful crisis, when cells and proteins stick to each other, causing blockages that limit blood flow and leave organs and tissues starving for oxygen. There are many disease processes during a sickle cell crisis, including blood cell breakage, increased cell stickiness, and abnormal clotting that your healthcare team tries to manage with fluids and medicines. The most ideal treatment may need to focus on each of the problems affecting blood flow, cell function, and cell survival. During sickle cell crisis, oxygen-starved cells can have small tears in their surface, which causes them to stick to vessel walls and other cells. MST-188 is the name of an investigational drug that is being researched as a treatment during a sickle cell crisis. Each molecule of the investigational drug has two parts, kind of like a Band-Aid, but with two slippery ends and a sticky middle. In the body, MST-188's center attaches to the small sticky areas on the surface of cells, and the two overlapping slippery ends keep other cells from attaching to the damaged areas. Like a Band-Aid, the binding of MST-188 to damaged cells helps them to survive, and the slippery ends improve blood flow. MST-188 is squeezed off the surface of the cell when the cell repairs itself, and leaves the bloodstream by way of the kidneys, like many other medications. When given to a patient, MST-188 is thought to keep cells from sticking together and restore blood flow. This process may reduce the problems that occur during a sickle cell crisis. Blood flow in the body is improved by the actions of MST-188, especially in the smallest of blood vessels, where a continuous delivery of oxygen and nutrients is essential for the life of tissue and organs. MST-188 is an investigational drug that is being evaluated in a research study to determine if it will help during a sickle cell crisis.